the tapeworms, based on the stages in human, we have the cestos, with the larval stage happens in human. Cystic echinococcus is the most important one, respect to the geographical distribution. And the next one was alveolar cyst. But we have the tapeworms which live in human as the adult stage. So human is definitive host. Even in human or animals, when we talk about the adult stage, all the cestos are living in the intestine of definitive host. Okay? Definitive host in the intestine. So in human, we have Taenia saginata, Taenia solium, Taenia asiatica. You see, when I say Taenia, it's the genus. This is the species, Taenia saginata. And it is in the taxonomy, genus and species should be written in italic, okay? It is a signal, which is a specific name. And always, genus should be started with the capital letter, and species is always with the small, okay, lowercase. Hymenolepiasis and Diphyllobothriasis. Okay. This is the classification. We are in this part, tapeworms, and I told you about larval stage, and these are the adult stage. Taenia saginata. So here I want to stress all the tapeworms as the adult stage are living in the intestine. So the symptoms are related to the intestinal tract, okay? Diagnosis is not so difficult, but because they are living in the intestine, so the eggs or proglotid are found and parasitological are helpful. The other things which is important, treatment of the adult stage is much easier compared to the larval stage, because the parasite just need affect on the scolex and neck area, because only scolex is attached, okay? So even with the single dose of the drug of choice, the patients get treated. So it's not so difficult. The first one, Taenia saginata, or the other name is Taenia saginatus. The length is several meters, usually 4 to 6 meters. Can you imagine? Sometimes even larger. And it is actually in the scolex or head just has 1, 2, 3, 4. 4 suckers. They don't have any hoops. If the tapeworm doesn't have hoops, it is called unarmed. If they have hoops, they are called armed. It means they have hoops. So this is the adult parasite, this is the scolex, and this is the body or strobila, the chain of the segments. Here, human is the host and the only definitive host. It means in the life cycle of Taenia saginata, presence of human is very necessary. It's not like echinococcus that human was accidental host. No, human is necessary in the life cycle, and he is the only definitive host. I mean, the adults are just in human, not in the animals. So human is definitive host. Animal, especially cattle, are the most intermediate host. When I say intermediate host, it means the larvae develop in the muscles of cattle. So human is definitive host. Adult stage are in the intestine. The eggs and proglotid are released in the environment. The eggs are eaten by the intermediate host, and the larvae develop in different muscles. When human eat the muscles of the cattle as a steak, as a kebab, so they are at the risk of infection. Uncooked meat, okay? So if they are raw or semi-cooked, the parasites can develop to adult stage in human. They have geographical distribution in all of the world. About 70 million people are at the risk, but they are more prevalent in sub-Saharan Africa, in the Middle East, in Iran, in your country, because you know we are very interested on such dishes, kebab, you see? So if the source is cattle or a steak, people are at the risk of infectivity. Okay, this is the larval stage. This is the larva. I told you for the larvae of every cestode, we have a specific name. For the Taenia saginata, we have a scolex, one scolex in a actually cyst in the bladder. The size is just a few millimeters, so it is called cysticercus. Since it happens in the muscles of the cattle, it is called Cysticercus bovis. So Cysticercus bovis is the name of the larvae of Taenia saginata. If you want to remember the size, you see the size of the cyst, when embedded, is nearly at the size of this hole. Okay. This is the life cycle. Human definitive house, proglotid in the environment, proglotid full of eggs are eaten by the intermediate house. The cysticercus babies develop in the muscles, especially striated muscles. When they are eaten by human, cysticercus develop to adult in human about 2 months. Let's see what is the clinical symptoms. Usually there's just one adult. Can you say why? Why just one adult? But for Echinococcus granulosus, thousands and thousands of adults can happen in the intestine. Why here we just usually have just one? Because the size is too big. Several meters, there's not enough space in the intestine. If it develops too many, it leads to the death of the patients. The parasites are successful that do not lead to the death of the patients, because the life of the parasites is always dependent to the life of the house. Okay? Without the house, the parasite will be died. So usually most of the patients are asymptomatic, especially adults. Actually, the most things that leads the patients referred to physician is unpleasant surprise when active proglottids are crawling through the anus and seen in the feces or clothing, moving in a manner very similar to inchworm. This is actually when they are moving, the segments is like this. So they are living in the intestine, so we have intestinal symptoms. Intestinal symptoms including epigastric pain, fullness, nausea, vomiting, chronic indigestion, and sometimes dizziness, headache, and pruritus ani. What do you think about dizziness and headache? It is living in the intestine. Why the patients have headache? What do you think? Yeah, the parasites living in the intestine, they have excretory material. This excretory material is toxic for the patient. So in addition to intestinal disorder, they may have headache and dizziness. Okay, also they are in the intestine and the proglottids are discharged from the anus, but sometimes we have such cases. Involvement of appendix, okay, the eggs are proglotted, and this is a rare case in a teenage girl. The adult is discharged through the nose. This is a rare case. The morphology scolex for suckers, these are the mature. When we have both male and female reproductive system, we say mature. This is the ovary, this is the testis, and this is genital cord, which is lateral and irregular. It means at the right side, left side. These are the egg. The egg of Taenia species and even Echinococcus species morphologically are identical. We see an embryo with 6 hooklets, which is called oncosphere, and the external layer is actually striated. These are gravid proglotid, full of eggs. This is the uterus. All these dark parts of masses of the eggs, and this is genital pole, which is lateral. Usually the patients have this part. This is unstained proglottids. This is stained proglotid. We can consider if it is the proglottid of Taenia saginata or Taenia solium. In the Taenia saginata, if you consider the main stem of the uterus and count the branches, usually the number of branches is more than 15, 20, 23. But in Taenia solium, the number of branches from the main stem is less than 13, about 7 to 13. The eggs of all the Taenia species are identical. For the chemotherapy, I told you when I said the parasites, there's lots and lots many. But when it comes to the chemotherapy, we don't have too many options. Here, I told you, praziquantel is a drug for all the platyhelminths. So here we have a cestode. Praziquantel is currently drug of choice, but as a single dose. But for the high data cyst, you can need to give several weeks. All right. So as a single dose, but the other drugs is niclosamide. You may do not find the praziquantel, but the alternative is niclosamide. But we need to follow the patient. If after several months he has proglottic discharge, we need to repeat the actually chemotherapy. Again, for the control, consider the life cycle. We have human, we have cattle, okay? For the human, health education is important. Do not spread the feces in the environment, okay? Actually, abattoir inspection is very important. If in the abattoir they find the cattle is infected, it is forbidden to be used in the actually people, for the people. Proper cooking is important. Freezing is important, leads to the death of the larvae. Also, a vaccine has been developed for the intermediate house. If any country afford, they can use. Okay. The next Taenia is Taenia asiatica. The name is showing which country it is prevalent. It means most Eastern Asian countries like China, Korea, Taiwan, and Japan. So we don't have so far in these parasites reported from your country. I just want to say the differences. In the scolex, they don't have hooks, just a primarily hooks. The cysts are mostly in the liver. Also, they happens in the muscles, but mostly in the liver. And the diagnosis, treatment, symptomology is very similar to that of Taenia saginata. Taenia solium. Taenia solium, the scolex has 4 suckers and 2 rows of hooks. The solium is related to the shape of the hooks, which is like solar system. Okay, these are the hooks. Human is the only definitive host, but pig is the most important intermediate host. About the disease, Taeniasis due to Taenia solium, what do you think? Is it prevalent in your countries or in the Muslim countries? Why? Because of the religious beliefs for not eating the pig, so it's not prevalent in Muslim countries. But in any countries, they use the pig. It is very important, especially not just for the adult stage. This parasite is capable of infecting human as a larval stage. So human is both susceptible to the adult stage and larval stage. And the larval stage is more severe with respect to the symptoms compared to the adult. So we don't have these parasites in our country, but it is very important, especially due to the larval stage. The larva is called cysticercus, the disease is called cysticercosis. Cysticercosis is a disease due to the larvae of the Taenia species, especially Taenia solium. This is the geographical distribution. You see in some African countries, in the Eastern Asian countries, and in the Latin American, it is prevalent. What about here? No. We don't have these parasites in Muslim countries. Although a rare cases may be happens for the people, they migrate to other countries, they have traveled to other endemic countries, the rare cases may happen, but it is not prevalent in the people who do not use pig. Okay, the life cycle is very similar to that of Taenia saginata unless the intermediate host is pig and many other animals, like for example, fox, dog, and bear, but usually humans do not use dog, except which country? India. China. China. In China, they use dog, many animals, so any parasites are prevalent in this country. This is the infected muscles. You see, every white spot is one larva. This is the scolex. Like the adult, the larvae have hooks in addition to the suckers. The name of the larvae, Cysticercus cellulosi. Cysticercus cellulosi is the name of the larvae. This is the life cycle. Human, the only definitive host, the last terminal proglottid full of eggs. In the environment, the eggs are eaten by the intermediate host. They develop to Cysticercus cellulosi. When humans eat the pig, they are infected to the adult. But the eggs, when are eaten by human, they lead to cysticercosis. There are also internal and external autoinfection. If a patient is infected with the adult stage and the proglottid discharge in the intestine, there is the risk of infectivity with the larval stage, or even external autoinfection. When the eggs are attached in the anus and the hands are infected, they digest the eggs and they get infected to the larval stage. So infectivity with the adult stage is a risk for cysticercosis. For the adult stage, the symptoms, the number of the adults, which is usually one, the diagnosis, treatment is the same as Taenia saginata. But I want to talk about cysticercosis. This is the egg, proglottid, scolex, and compare of the proglottid with that of Taenia saginata. Chemotherapy. Again, praziquantel, first choice. The alternative, niclosamide. In order to parasites have better actually discharge, we can use some juice, sour juice fruit, to help for the removal of the adult. Okay. Cysticercosis is infectivity of human with the larvae of Taenia, especially Taenia solium. We have cutaneous cysticercosis. You see every spot pea-like nodules are one larva. This is a lady from India which has used infected with the larvae of Taenia solium. So muscles and subcutaneous is prevalent. Neurocysticercosis, involvement of the brain. You see 1, 2, 3, 4, too many. The size is small. The size is not like hydatitis is too big. Just a few, but too many of them can happen in the brain or other tissues. The symptoms are variable, but the most prevalent, actually common symptoms are epileptic seizure, headache, and behavior disturbances, hydrocephaly, and hypereosinophilia. Hypereosinophilia is very important in helminthic disease, especially anyone has internal tissue invasion. Okay? One person infected with helminthic disease may don't have any symptoms, any complaint, but during the CBC you find they have hypereosinophilia. So hypereosinophilia in the helminthic diseases, Taenia solium, hydatitis, or other diseases I'm going to mention, if they have invasion to the internal tissues, are very important. All right? So here we expect hypereosinophilia in infected patients. Sometimes the cyst in the brain has branching, and it is called race-mace cysticercosis, which is more dangerous. They may invade the eye. Usually one eye is involved. This is the larva, this is the scolex, this is the scolex, and this is the larva. Okay, different part is involved in the eye. If they get to the retinal detachment, affect on the vision. Sometimes in the chronic phase, they may have that actually lack of vision. For the diagnosis, I mean diagnosis of cysticercosis. Again, parasite in internal tissues, serological test, imaging technique. Okay. In case of subcutaneous tissues, biopsy can help to find the parasite. What about the eye? Use of ophthalmoscope to see the parasite in internal part of the eye. So it is very easy to guess about the diagnosis if you know which part of the body is involved. For the treatment, I mean treatment of cysticercosis. Actually, cysticercosis is inflammation of the body to the larvae, which is rupture. So use of corticosteroid to actually lessen the inflammatory response is important. We have again praziquantel in addition to albendazole. So chemotherapy is very similar to that of hydatitis. Praziquantel, albendazole, or mebendazole. Everyone is accessible. Sometimes surgery is needed or use of ventricular shunt. The other cestode is called Hymenolepiasis or dwarfiform. It means very small because it is just a few centimeters in length. It has worldwide distribution. It has direct transmission, so it is more prevalent in children. We have this parasite in every country, especially in children. These are the eggs. Inside the eggs, there's an embryo, but the outer layer is very thin. It's not like that of Taenia saginata. This is the larvae, okay? Since the size is small, so too many parasites may happen in the intestine of human. This parasite is the only tapeworms that both adult and larval stage develop in the intestine of human. It means that it doesn't need necessarily different intermediate host and final host. So both definitive host or final host and intermediate host are the same human and both stages in intestine. Actually, development of the egg to the larvae happens in the intestine of human. So again, they are in the intestinal part of the body. So the symptoms are related to actually intestine, including abdominal pain, nausea, vomiting, urticaria, itchy bottom, dizziness, and especially if the children has malnutrition, it may happen to severe infectivity due to autoinfection. Autoinfection happens in case of infectivity with these parasites in children, and in the people which has actually like AIDS patients, the infectivity with autoinfection is very important. This is the egg, embryo, booklets, outer embryo. This is the intestine. several parasites are embedded in the intestinal mucosa. The scolex has 4 suckers, 1 row of hooks. These are the proglotids. Proglotids are trapezoid in shape, and just a few centimeters. For the treatment, okay, tell me what is the treatment? Praziquantel, alternative niclosamide. You see? So don't worry if you want to memorize about the name of the chemotherapy, because we don't have, unfortunately, we don't have too many options. Just a few antihelmintic drugs. Praziquantel, niclosamide. But here, because of autoinfection, reputation is important and family treatment is recommended. Usually because of direct transmission, people give the infection to other members of the family. So family treatment is important for hymenolepiasis. For the prevention, it is direct transmitted. So people, especially children, which use the habit of putting the fingers in the mouth, they are at the risk of infection. Good hygiene and fruit, vegetables, washing is important. Well-balanced diet is important. Sometimes the rat may be infected, so an elimination of the rats from human settlement is important. So control of the disease in the children should be actually emphasized, especially the children used to do the finger biting. There's another tapeworm which is called Hymenolepiasis diminuta, or rat tapeworm. It is very prevalent in the rat, but human cases is very rare because it doesn't have direct life cycle. The intermediate stage is developed in the actually insect. Okay, in this insect like beetle or flea, they act as intermediate house. So the human infectivity is very accidental. When the people, especially children, eat the contaminated food, which is the larval stage, happens in the insect. So in the rat, very prevalent in the world, but the human cases are very rare. Okay, any cells that I told you so far were in the group of Sacrophilidia. It means they have suckers. But we have another group of tapeworms. Instead of suckers, they have 2 groups, which is called Botria. In this case, the adult stage in the group of Pseudophilidia, they are called Pseudophilidia. The adult stage is Diphyllobothrium latum, human act as definitive house, but there are subspecies which is called Spirometra happening in the animals. Human is infected to the larval stage. This is Diphyllobothrium latum, actually the largest tapeworm of human. Can you guess about the size? Give me a number. Yes. 10 meters? Any more? 12? Any more? Usually it's 10 meters, but it may be as long as 30 meters. Can you imagine? 30 meters. Much higher than the length of this room. A parasite with 30 meters in length can live in the intestine of one patient. So usually it is about 10 meters. Actually, the largest human tapeworm, the largest human parasite is Diphyllobothrium latum. It is called fish tapeworm. Fish tapeworm because humans get infected by eating contaminated fish. All right, the larval stage develop in fish. Which country is prevalent? It is mostly in any areas that lake and rivers coexist with the human consumption of raw or undercooked freshwater fish. Can you give me the name of a dish which is prepared by raw fish? Sushi, exactly. Sushi or any fish that the raw fish is used, people are at the risk of infectivity with such parasites. So it is prevalent, for example, in Scandinavian countries and some part of Africa. This is the life cycle. In the life cycle, actually on the pseudophilidian parasites, part of the life cycle is happening in the water. They use aquatic host. So human and any fish-eating animals are at the risk of infection, adult in the intestine. Eggs are released in the water, okay? The larvae is ciliated. Why the larvae is ciliated? Because in the water they need to swim. The larva is ciliated. It is called coracidia. The first intermediate hosts are crustacean, like cyclops species. When the first intermediate host is eaten by second intermediate host, which is fish, the larva, which is called pleurocercoid, develop in the muscles of the fish. When they are eaten by definitive host, adult lives in the small intestine. Okay, they are in the small intestine, so we have intestinal disorders like abdominal pain, discomfort, diarrhea, weight loss. One of the most important features of Diphyllobothriasis, the adult parasites actually absorb vitamin B from the patients. So patients have vitamin B12 deficiency, and after that they have a macrocytic megaloblastic anemia. So macrocytic megaloblastic is specific to Diphyllobothrium latum due to vitamin B12 absorption from the host. The other consequences is like tinea, actually involvement of appendix, obstruction of the intestine may happens. Adults are in the intestine, the eggs are released in the stool, so stool examination is important for the diagnosis. The anemia, macrocytic megaloblastic, especially in endemic areas, is an alarm for this disease. This is the scolex, which have botria. For the treatment, tell me about treatment. Chemotherapy. Praziquantel, niclosamide. All right? Niclosamide is just for the adult stage. I didn't mention niclosamide for cysticercosis or hydatidosis because it doesn't affect on the larval stage. But praziquantel is effective both for the adult stage of tapeworms in intestine and the larval stage of the tapeworms in different internal tissues. Okay, the first choice is praziquantel, and the alternative is niclosamide. But in addition of chemotherapy, we need to prescribe vitamin B12 for the patients. For the control of marketing of fish, proper cooking, freezing, and sanitary disposal of sewage is important. Diphyllobothrium latum is a pseudophilidian which infect human as adult stage. But we have some other genus which are Spirometra. You see, any carnivores which use the meat, they may act as definitive host. Egg in the water, Miracidia, first intermediate house, second intermediate house, fish, frog, even a snake. People who use the frog, a snake, to eat, or some traditional places, especially in Eastern Asian countries, believe use of the flesh of the frog for the actual lesion is a treatment. So they are at the risk of infectivity of the larval stage of the Spirometra, which is called asparagnosis. Asparagnosis is a disease by the larval stage of Spirometra species, which are a genus in the Pseudophilidian tapeworm. What about this disease, asparaginosis? What do you think? Is it prevalent in your country? No. Why? Exactly. In the wide environment, it may be prevalent. For example, in Iran, we have the life cycle in the wildlife between the carnivores and the frog snake. But use of frog as a food is not common in such countries. So you don't have this difficulty in your country. Sometimes medical students ask me, for example, we don't have this parasite in our country. Why we should know about that? What you answer? If you were in my place, what did you answer? Medical, yes. Exactly. Exactly. Well done. I'm very glad to hear that. We have actually travel medicine. In the future, you may have many patients coming in you from other countries, or the people from your country may travel to other part of the world and get infected and refer to you. You need to know about the history. You need to ask about them. Did you have travel? Which part of the body you travel? So if we are going to tell you about geographical distribution, you need to know each part of the country, which parasites are specific endemic to that part of the country. Okay, that's the reason. But our emphasis is on the parasites prevalent in your countries. But we speak about other them like Taenia solium, about asparaginosis, because it is important in the medicine, although the infection in human is restricted, depends on the actually traditional, in for example, eating frog or putting the frog on the lesion, or for example, use of pig. That's the reason we tell you about the parasites which are not prevalent in your countries, but they have medical importance. This is asparaginosis. When I say larval stage, different parts of the body may be involved. Eye, brain, cutaneous lesions, again the eye, or other part of the country. So we have involvement of internal tissues, diagnosis, again, serological tests, imaging techniques, all right? For the treatment, surgery, if the larvae is in the eye, if you just give the anti-inflammatory, anti-emetic drugs, it's not proper. It may lead to higher inflammation. So in such cases, especially in the eye, removal of the cyst and doing surgery is important. For the prevention, avoid ingestion of contaminated water, avoid use of tissue of frogs and other cold-blooded animals like a snake. Frogs or a snake for medical purpose. Give me the name of a country they are using frog and a snake to eat people. China. Sufficiently cooking the meat that might contain espargana. Espargana is the name of the larva of Spirometra species, and surgical removal of esparganum and the nodules containing the larva. For example, if the larva is on the face, if it does not remove, they migrate to the eye. All right, so removal of the larvae is very important. Okay, we are going to have a small break. After that, we are going to do the quiz